Good evening, everyone. I hope you all are doing great. So without wasting any time, let's get start to our topic. So today our topic is interlocking nailing in tibia fractures. So I think interlocking nailing is the most common surgery will be performed by an orthopedic surgeon or orthopedic residents also all over the India. So and tibia is the most common fracture in all over body. So हम लोग ऐसे इमरजेंसी के अंदर ही इतने सारे टिबिया फ्रैक्चर्स देख लेते हैं. Tibia is a subcutaneous bone, all we all know, because of its there's a very less soft tissue envelope around the tibia, so it has a very less blood supply also, mainly in the distal tibia part. So this distal tibia mainly has ligaments and tendons. So distal tibia is having the very less blood supply, due to which the non-union and malunion part is very common in distal tibia, as we can see. So let's come to the morphology of the tibia nail. So tibia, this is the tibia nail, which is also known as an expert tibia nail. So ये हम लोग के दिमाग में बहुत बार आता है कि why it's called expert tibia nail. It is called expert tibia nail. This name was given by Depew synthesis because of its multiple locking options. This modern nail gives us multiple locking options, uh, which by which we can like fix metaphyseal fractures and diphyseal fractures also, and also we can fix segmental fractures. Previously, which was done by plating only.
Tibia fracture can severely impact mobility and daily life. For many unstable tibial shaft fractures, interlocking nailing is the gold standard treatment. A metal nail is inserted into the bone's medullary canal through a minimally invasive approach. Interlocking screws at both ends provide rotational and axial stability. This technique restores alignment while maintaining the natural biology of fracture healing. Patients often benefit from earlier mobilization and improved functional recovery. Interlocking nailing, strong fixation, faster recovery, and better outcomes for tibial fractures.
Then we come to the trajectory of the guide wire. Trajectory of the guide wire, as we can see, in proximal part of the tibia, the guide wire should be along the axis of the tibia in AP, as I have told in the previous slide also. And the entry should be just medial to the lateral tibial spine. And in lateral view, we can see like the guide wire should be at the edge of tibial plateau, and it should be go to parallel to the anterior cortex of the tibia. And in distal tibia fragment, as we can see, the guide wire should be at dead center in both AP as well as lateral view. If there is a distal tibia fracture and your guide wire is going like laterally or medially, it will produce valgus or varus malreduction in distal fragment. So keep in mind, if your guide wire is going laterally or medially in distal tibia fractures, either you can use like polar screw, as I told you the concept of a polar screw, how to use it, or you can like maneuver it, like this is the bolt tip in the end of guide wire. This will like give you an idea what's the direction of guide wire, how you can manipulate it. Okay, so your guide wire should be in dead center in distal tibia in both AP as well as lateral view. Then comes the most controversial topic, the reaming. There is a very controversies are going on around whether you have to ream, whether you have to not ream. Ream versus
A successful tibial interlocking nail starts with one critical step: the guide wire trajectory. The entry point is established just medial to the lateral tibial spine on the AP view. On the lateral view, the guide wire begins at the anterior edge of the tibial plateau. The guide wire is carefully advanced into the medullary canal. Maintaining a central trajectory in both AP and lateral planes is essential while crossing the fracture. The wire should remain centered throughout the canal to avoid malalignment and cortical breach. Once satisfactory positioning is confirmed, sequential reaming is performed. A precise guidewire trajectory lays the foundation for accurate tibial interlocking nailing and optimal fracture alignment.